And so on to our final presentation of the day, and hopefully we'll have some short time afterwards for any questions or comments. But next up, we're going to hear from Marie-Louise Sloan, and as a social work leader, her and her team designed a framework especially for engaging directly with children and young people. So we're just going to see a short video.
Hello, my name is Marie-Louise Sloan and I am currently the Head of Service for Specialist Residential Care in the South Eastern Trust. Today I would like to take an opportunity to provide an overview of the development of the STORY framework, which is a child-centred assessment framework for engaging children and young people in areas that matter most to them during professional involvement. I would like to start with explaining the background to the development of the STORY framework. Between 2015 and 2019, I was a principal social worker based in the Newcastle Child and Family team. Our service, like most field social work teams, worked with children up to the age of 18. Our involvement ranged from a family support role through to child protection and looked after care experienced young people. Similar to many teams, our challenges centred on high caseloads and subsequent paperwork involved with these. Staff turnover and retention was a significant difficulty due to our rural location with limited access to voluntary and community services. During exit interviews, staff reported job dissatisfaction in not having enough time to work with children and young people. This was also linked to a common theme identified from case management reviews in relation to the voice of the child being unclear during assessment and involvement with social work teams, and areas like family trees and chronologies not always being visible in files, despite staff reporting that they had covered these areas during their involvement. Another area I was mindful of was, whilst it was positive in Northern Ireland that we have a common assessment framework called the Unicini, staff report that it is not a child-friendly document and wouldn't be something that you would want to present to a young child as a focus of your discussion. Whilst we have committed staff wanting to deliver high-quality, child-centred services, our mandatory paperwork doesn't promote or guide staff in the regard, and as the saying goes, if it's not in the file, it didn't happen. From a child and family perspective, our challenges were inevitably impacting on the quality of service that we provided to our children and families. A common area of concern is the child and family's anxiety around the social work role, and in the absence of a child-friendly framework, it was felt that guidance around common areas that should be covered with young people would be helpful to structure our involvement. Family feedback identified a feeling that case conference reports and looked after children reports often focus on what a parent is or is not doing rather than the well-being of the child. And as a manager, I was finding an increase in young adults requesting their social work files, and I had great difficulty in trying to go through large amounts of redacted files to help young adults and parents later in their life to explain what was going on for them during their childhood years from a social work perspective. In considering new ways, I took cognizance of the research around the need to reclaim relationship-based practice and enabling workers to build on their desire and develop their techniques in engaging with children and families, which would hopefully promote and provide better outcomes for the social work, child and family relationship. In 2017, I had a fantastic opportunity to complete a Quality Improvement Fellowship, and I was challenged to identify a project that was a strategic priority across children's services. I attended the BMJ Quality Safety Forum in London and was inspired by a keynote speaker, Margaret Murphy, whose son had died through medical error. She reflected in her preparation for her presentation that she hoped she would be able to tell her son's story and experience the way he would want it to be told. This highlighted the importance of building something that enables us as workers to help families at a later stage to understand their experiences. When considering the concept of promoting a buy-in and ownership approach with my team, this project needed to be an area of interest for the whole team, and collectively we agreed to develop the STORY framework and apply a quality improvement methodology to its development. Looking at our overall aim for this project, it was to 80% of all children aged between 5 to 17-year-olds that engage with the Newcastle Child and Family team will have a child-centred assessment and plan by February 2018. Firstly, we completed a baseline to evidence the need for an improvement, and based on 52 children known to our team, 82% of the children reported they were unaware that they had a plan in place to support them. The same percentage reported being unclear of the role and not feeling listened to or involved. This was echoed by senior social workers and principal social workers right across the service who reported that children's views and goals were often unclear in their assessment. Children's comments included they thought the social worker called to see their parents, they were unclear why the social worker visited, their experience of turnover of social workers, and that visits often concentrated on how have you been since the last visited, how's school, etc., and largely determined by the social worker. When considering the factors that impacted on our social workers' ability to form child-centred plans, there was a collective agreement across the team that a lack of child-friendly assessment framework was the biggest contributory factor. This formed the basis for our improvement focus. Our project team had representation from social work, health, voluntary sector, children and parental representation. In considering our framework, we looked at learning from our colleagues in Scotland by focusing on a person-centred approach. Initially, we took a person-centred planning tool and held focus groups with young people who designed the areas that they felt mattered most to them and would be happy to discuss with their social workers. Our first draft was designed by our young people and staff. Through testing, we identified further development and a final draft was developed. It was important to ensure that we supported the regional strategic priority in relation to the 3 houses exercise that is used as part of the signs of safety approach. It was agreed that this not only complements that, but enhances this approach by going further to address other key areas that had previously been identified as needing a focus. With 65% of the population being visual learners, we were really challenged to create a child-friendly, colourful and visual framework that was simple and easy to understand. Through collaboration, it was also agreed that this framework should be presented on 1 page. An interactive page tagger was developed in partnership with our learning improvement team to bring the framework to life and enables workers to allow children to flick through each area, and a child-friendly explanation was provided by our young people. The page tagger is easily accessible from a hyperlink, and the toolbar down the left-hand side enables workers, children and families to understand the background and process. The full document is available to click on at the bottom of the toolbar. The main page also has pop-up explanations of what each of the 9 domains on the framework focus on. The language used to explain each of the domains has been developed by children and young people and includes family tree. Each story where possible should start with the child's family tree, thus enabling workers to explore a genogram, eco map to determine family members and other key relationships for the child. Good things, likes and hobbies. Likes and hobbies enable workers to explore interests, strengths and good things in the child's life. My School. My School allows workers to discuss school life with the child, subjects, peers, teachers and general feelings and views around school matters. The Wishing Well. This concept encourages exploration of hopes and dreams the child may have and allows for discussion about why these are important to the child and how these could be achieved. The Worry Wall. This explores areas a child may be worried about. Worries can be added onto the worry wall and it enables the practitioners to identify goals to address these worries. The Safety House. This considers risks a child may have or be experiencing and promotes the use of a safety plan which is age appropriate and relevant to each particular child. My Journey. This underpins the work and identifies key significant events in a child's life. Parents and carers can provide photos which capture the journey and workers can facilitate discussion around the meaning of significant events to the child. Support agencies can provide advice and support when exploring these issues with the child or young person or parent. The Parking Space. This is an area where an issue or a question that is important to the child can be parked to enable workers to clarify further information on the area the child has acquired about. An issue such as domestic violence may also prove to be too painful an issue to explore with the child at that time and can be revisited when the child or young person is ready and a greater therapeutic alliance is established with the worker. My Space. This is an additional area for free narrative, thoughts that are not covered within the domains of the framework. It is important to acknowledge all contributions the child has made, and My Space captures these additional thoughts. We recognise that each child's preferred communication style is different. some like apps, worksheets, board games, drawing, and this recognises that by providing autonomy to workers, but also ensuring consistent themes are covered. Alongside this, we have an electronic folder with a worksheet of each of the areas and small measurement tool which enable children and workers to consider how important, worried, safe they feel about the areas they are discussing. It also enables workers to tune into the preferred method of communication, such as writing, drawing, or uploading pictures of the content to the worksheet. There is also room for the workers' analysis of the sessions and what they felt was significant for the child during that session. A person-centred training programme was also developed to empower and enable staff to implement the proposed framework. In addition to developing the framework, we work with an adolescent group to develop a version for older children, and a one-page profile was created. Again, this is very self-explanatory and easy to access. It was always important from the outset to be able to bring an outcomes approach to this project, and one way of capturing our qualitative and quantitative feedback from our children and young people. A co-designed feedback form was developed, and the use of emojis was a preference for the children. Following implementation over the preceding months, we reviewed children's experiences and identified an improvement. We increased children's views of feeling listened to and involved from 18% to 94%, with the same improvement in children reporting their awareness of the safety network. A balancing measure that we were initially concerned about was that staff may feel that this would impact on their time. However, on evaluating their feedback, it was identified that this was not the case, and in fact they reported they focused their time with a better quality discussion with their children and young people. Their experience was that children engaged freely, and collectively as a team they were able to compare and contrast various tools and methods of engagement under each of the areas. 46 of the 52 children were observed to positively engage with the framework. 3 did not, and 3 were observed to just generally go through the motions rather than meaningful engagement. We used an outcomes-based accountability framework to present our outcomes, and were able to present to senior and executive management teams across the Trust alongside the Regional Steering Group for Signs of Safety as a method of evidencing our outcomes. We've had really positive feedback from Professor Eileen Munro and have met with her to discuss this, our methodology, our development and our outcomes. She has subsequently shared it with the HSE nationally. My hope for the Story Framework would be that this could be used as a regional framework for both voluntary and statutory agencies to engage and work with children and young people. It would be fantastic to see a framework that is being co-produced by children and practitioners applied to complement our existing regionally agreed frameworks.
Finally, how fantastic would it be to consider our future reporting, not only focusing on how many children we have involved in our services, but how many of these children feel listened to and involved in their assessment and plans.
Thank you for listening, and I'm happy to answer any questions you may have.